Hey everyone, I'm Nikisha Brown with Sac Cultural Hub and the Hub magazine, and we are here tonight at the Sierra Health Foundation for Sac Hub's first Black Physicians Forum, and that will be taking place tonight. Our MC for tonight is Dr. LaDonna White. We have keynote speaker Dr. David Carlisle, and lots of physicians and information that we're going to be presenting to you tonight. So thank you so much for joining us, and we will see you soon.
At the 2011 Black Physicians Forum, we have the president of the Sierra Health Foundation, Chet P. Hewitt. So Chet, tell us how your role and why Sierra Health Foundation felt that it was important to present the Black Physicians Forum and to focus on health disparities in the African American communities of Northern California.
I think there are two really important reasons why this. One is, I've been in a lot of forums where folks have talked about health disparities and how that impacts the African American community. And what has been less present than it should be is kind of the authentic voice of the community. Both from folks who live in the communities where those disparities are present, but also the physicians, particularly those of color, who have worked and are treating the residents who live within those communities. So tonight really is an opportunity to kind of gather them together, talk about the cost of shortened lives, poor health, and how that's impacting the families and communities that we're from and we care about. And of course we care about all communities, and what we can do collectively to change that reality.
That's wonderful. I think this is going to be a great event and very educational for everyone that attends it, and I look forward to many more in the future.
So do I. It's going to be a great night.
Absolutely. Thank you so much.
Welcome to Northern California's Black Physicians 2011 Forum. Well, tonight we join in the battle to end healthcare disparities in the urban community. Tonight's keynote speaker is Dr. David Carlisle, who is the director of the Office of Statewide Health Planning and Development for the state of California. Tonight's MC is Dr. LaDonna White, and we are here all on one accord to tackle the disparities within the urban community. Again, this is the Northern California Black Physicians 2011 Forum. Okay, I'm standing here with our honorable mayor, Mayor Kevin Johnson of Sacramento. I just have one question for you tonight. And first of all, we have to say thank you so much for joining us tonight for the first annual Black Physicians Forum. Now, as a call to action for healthcare administrators and physicians, what strategy would you suggest that they use within actually to reduce the healthcare disparities within the African American community?
I think the most important thing that we can do as a community and the African American physicians and administrators, it's about awareness. We have to educate the public, outreach, awareness, make your voices heard. There's so many people in our community, we don't know the issues of obesity or cancer or diabetes or dental disease, all these issues that impact our community. We're impacted adversely, but we need our physicians to help educate us, and then as elected officials, tell me what my marching orders are, and I'm going to be the first one out in the community doing my part.
Okay, well said. Thank you so much for joining us tonight. Thank you.
Okay.
Okay, so I am standing here with Dr. Hunter. Now, can you tell us where exactly are you practicing?
Well, my paid job is with Kaiser Permanente, but the job I love is actually serving the African American community as an oncologist. I treat cancer, and part of what I do in the community is try and raise awareness of the fact that we can impact on cancer death rates by finding it early.
Okay, now have you ever attended a Black Physicians Forum before?
Well, to my knowledge, this is the first one, isn't it?
Okay. Now, what exactly are you hoping to, what are you looking forward to with tonight's event?
I'm looking forward to synergizing with other professionals to have a concerted effort to reduce the disparities of death rates with African Americans. I'm working with about 17 other community partners to address this as far as cancer disparities, but we're facing death rates in multiple areas outside of cancer, hypertension, diabetes related. So I'm hoping that we can combine some of these efforts and work together a little bit more on that.
Now, within the news, we hear a lot of the disparities that are taking place, as you mentioned, diabetes, cancer. A lot of them are the leading factors within African Americans as far as causes of death. Why do you think that is? Is it more so a cultural thing, or is it genetics?
I think that there's an element of both. When we look at cancer, for instance, we see that with women, African American women, higher rates of breast cancer in younger women, women under the age of 40. We also see higher rates of very virulent type of cancers, the so-called triple negative, in African American women. We see them about twice the rate. So genetics does play some role, but there's also the fact that African Americans either don't have access to preventive services, or if they have access, they're not being encouraged to utilize them, or they have mistrust of the healthcare system for a lot of historical reasons. A lot of us know about the Tuskegee experience. Well, that's still playing a large role, things like that, or stories like that, in terms of African Americans wanting to seek medical attention for certain things as a preventive cause.
Absolutely. Okay, well, thank you so much for joining us tonight, Dr. Hunter. Thank you very much. Okay, so I am standing here with Dr. LaDonna White, who was our MC for tonight. It is so good to see you. So as you know, we are here tonight basically just creating dialogue for the black physicians. Now, we're actually dealing with obviously the disparities that plague our urban community. What would you say is the most alarming disparity within the urban community?
No health care or limited health care access, or lack of knowledge of healthcare access. And since there's so many people who don't have insurance, there's so many people who are not even seeking whatever potential free healthcare or limited healthcare there is. And that's bad, because by the time I see them in the hospital, they're really sick. And once they get better and they leave the hospital, there's nowhere for them to go. So access is a really big problem.
And so, obviously, with the things that are preventive, like type 2 diabetes, other things that can be prevented with having, you know, a doctor to go to, or having the medical insurance, a lot of those things wouldn't even be an issue if the care or the insurance was available to within our community.
Yes, exactly. The downside to not having enough health care available in terms of insurance is also lack of access. But on the flip side of that, with insurance, with the ability for people to go and get what they need, it's going to reduce a lot of the health disparities that we have in our community. Or at least we hope so. Still, in our community, going to the doctor isn't necessarily the best thing to do when you have other things that you could be doing.
Okay, and what are you hoping to get out of tonight's event?
Some strategy that we all can think about independently and collectively that maybe is a workable solution to move towards a more permanent solution. We have to start small, grassroots, something that maybe we all can do together on a small scale that maybe one day can grow and really assist our community at large in getting the health care they need.
Well said. Thank you so much, Dr. White. Thank you.
Here we have Dr. David Carlisle. Dr. Carlisle, tell me, what do you see as the key role for African American physicians in treating and seeing African American patients today?
Well, I think African American physicians are on the cutting edge of improving health for the African American community. Not just physicians, but all healthcare providers, but physicians especially are on the cutting edge and can serve not only as care deliverers, but as care motivators for the community. And so much of achieving good health and good health care is a question of getting that push to seek the care that one needs.
Absolutely, absolutely. That's very key. And just the knowledge, you know, having that knowledge base and having a relationship with your physician when you feel comfortable. So we appreciate you being here tonight. And
it's a pleasure to be here.
Absolutely, and we appreciate the fact that you're helping us to minimize the disparities of healthcare and health issues with the African American population.
Disparities are a critical issue for the African American community, and something that we should work diligently to eliminate.
Absolutely. Thank you so much.
Thank you.
I did not know that there were that many people of color that were physicians. So I want to just thank Chet just for his leadership of convening everybody in the room. Yes, we're going to hear about the disparities, that's important, but we're going to hear ideas and solutions and things that you think that we should be doing. Your voice needs to be very loud in our community. So whether you're from the Bay Area or Sacramento or further north, you have to help us, empower us, give us the ideas that as an elected official that I can do to be helpful, what our community needs to do. We're always talking about diabetes, obesity, the dental diseases, cancer, all those, any indicator that's negative, we're at the top of the charts. And we've got to flip that script.
I ask that you please look through this beautiful color booklet. This is absolutely beautiful. You will see the statistics in here on obesity, cancer, diabetes, and dental disease.
That's right. Get started.
That's what I'm trying to
You've seen the data, you've seen the numbers that Dr. Carlisle presented. To use his word, it is a travesty. A preventable one at that, which makes it even deeper than perhaps a travesty. And that's a very, very powerful word. We can do more and better for our communities. As leaders in your communities, they say that to whom much is given, much is owed.
The program went very, very well. It was put together very nicely. All the doctors were all engaged. Many of us came together for the first time, met many physicians from Stockton, from Northern California, and it was great. Everyone is excited. This is the first time that we have all gotten together as a community, and now we are going to work as a community to go forward, to be able to present to the community, to be able to offer, whether it's free medical advice, medical care, as well as dental advice and dental care. We're all looking forward to it. We can't wait till the next spring fling, and it's coming up very soon.
I would think that the one point that I would recommend my colleagues to do in terms of help ending racial disparities, if I took one specific disease, that would be obesity. And that would be looking at one of your patients that are underrepresented minority and addressing their weight and looking at all the complications that are associated with their weight and having them lose weight so they can improve their health, and really to teach them about how to do it, not just telling them they should do it, but show them how to do it.